Paige. I'm going to be your student nurse today. Can you just identify your name and date of birth for me? Looks good. Ensure privacy. Miss Smith, do you have any allergies? No? Okay. Well, today I'm just going to be assessing your wound and irrigating it per your doctor's orders. I'm just going to put on my gown.
We can record telling what you're gonna do in case you don't like it.
Are you having any pain today?
Then I'm going to start peeling back now. Old dressing.
Hi, Mr. Smith. I'm Emily Flores. I'm going to be redressing and irrigating your wound today.
Gowns are tricky. Nobody taught you how to tie a gown backwards.
So then I would assess the dressing and dry and back, fold it upon itself.
On my mask.
Then a situation that might assess the drainage and what kind of put it right in my
Okay, I'm just going to raise you
Hi,
up.
Mr. Smith. I'm Emily Flores. I'll be your nurse today. So today I'm going to be cleaning your wound and
Let me put my
dressing.
gloves on.
Can you tell me your full name and date of birth, please?
John Smith, 32297.
Okay. I'm just going to slip this underneath your leg. Oh my gosh. I'm going to put this towel over you so that you're more comfortable. Okay. Now I'm just going to take off your bandage using the push and pull method in the direction that the hair is growing.
Your date of birth and your name. Everything looks good. Okay, typically I would raise the bed. I can't really reach the control here, so my partner.
Push pull to get all 4 pieces of tape off. Maybe. Start at the top.
I'm going to go ahead and close your curtain and your door so that you have some privacy.
Okay, I'm going to assess this dressing for odor, color, and amount. Everything looks normal. And now I'm going to assess the wound for redness, tenderness, color, odor, etc. Now I'm gonna measure your wound. The length is about 3 inches long, half an inch wide. Now I'm gonna measure the depth.
When it started, starting age was 5 and was 8. It's intact.
So I'm going to check for tunneling in all directions of the wound. Looks good. I'm going to measure the depth.
You can touch the outer edge.
It's about 1 inch deep. I'm going to set this basin under the wound. Now I'm going to remove my gloves.
There's water in the mouth. There's no powder.
Perform hand hygiene
I would assess his wound in the area around
before I start setting up the sterile.
redness and regulation. Everything looks good and normal.
So first I'm going to set up the sterile plate, which I'm just going to drop.
And perform
Be sure to remember that the outer 1 inch is considered contaminated. Now I'm going to add all of my materials,
put the top down.
making sure to open them
Perform hand hygiene. One of the
that's not
gloves.
away from the
Put the
top.
water from the pad down by the sink so when I irrigate, no water gets on the side.
This would be in a sterile package, but I'm gonna open it up, drop it on there.
Stop laughing at me.
Now I'm gonna continue. This also would be in a sterile package. Drop it, making sure to keep it at least 1 inch above the sterile field. Cotton swab. Add to the dressing. Now, since this touched the outer 1 inch, I'm going to move it back, but normally it would be contaminated. Okay. Now I am going to check the date, label, and seal of the antibiotic ointment, which I already put on here, but I pretend to put it on there, making sure to not touch the applicator to the plastic. I'm going to do the same for the liquid. I'm going to place my hand over the label, checking the date, expiration, and seal. Pouring this, making sure not to splash.
What? Oh, that fell. Oh, yeah, there.
Now I'm going to sterile glove. Maybe.
So if you guys are taking this quiz, you guys will maybe come.
Normally I would not touch this, but since the outer 1 inch is contaminated, it's okay. I'm going to use my non-dominant hand, loosen up this, and slide this on, touching only the inside. Now I'm going to slide my dominant hand glove to here, maybe, so I can touch because it's sterile. Stick it right here.
I also would want to check that.
Drop in here, and now I'm gonna prepare to irrigate the wound.
Emily, when you put on the PPE,
Put it on?
Yeah.
I did.
So I'm gonna irrigate from top to bottom,
I was going to right.
Take it off the opposite leg.
making sure my right hand stays sterile. This will be my clean hand. So I'm gonna irrigate it until the liquid is dry, or the liquid is clear, from top to bottom,
Well, the gloves go on the table.
making sure to not touch the syringe to the patient. So the liquid is clear, so it is irrigated. Put this back on my sterile hand. This is no longer sterile. Now I'm going to use my non-sterile hand, maybe, to tap the inside of this, to dry the inside of the wound first. Now I'll dry the outside from top to bottom.
Minute till when the quiz is starting.
Now I'm going to use some cotton swab sterile. Get the antibiotic ointment on there and clean it from top to bottom, which I'm not actually going to put on, but top to bottom. Discard and biohazard. Now I will apply gauze with my sterile hand. So I'll start at the bottom, and I can touch it with my clean hand. Apply another piece of gauze. Apply the ABD pad, blue side up. And then I will apply the tape. Yikes. Which normally I would have already labeled this piece of tape with my initials and the date and time that the dressing is getting assessed. This is just to keep it in place Now I'll take off my sterile gloves. Perform hand hygiene before putting on clean gloves. Now I'm going to take the rest of the wound. All 4 areas. Difficult. Maybe. Okay. And like I said before, normally I would have already dated and timed and put my initials on this piece, but since I didn't, I'm going to do this. Then I'm going to clean off my patient's area, discarding inappropriate biohazard or etc. containers. After I've cleaned up, I'm going to take this off, take my gloves off, perform hand hygiene. Move, not pull down. Cover the patient back up, ensure their comfort. So, Mr. Smith, are you having any pain now? No? Are you comfortable and can I get you anything? No. Thank you for letting us take care of you today. I'm going to lower your bed back down. And your call button is on the side if you need us.